All right. Let's do this one differently than we've done before. Let's go to the lower appendage, and let's do the crural area first. It's only one muscle. Okay. This is called the tibialis anterior. Well, now take a look. Here's the thing. Look what bone you have right here, tibialis. Okay? The muscle right next to it on the anterior surface has to be the tibialis anterior. Okay? Don't go off on the side. Tibialis anterior. You're done. Now, go to the posterior. Large muscle with a big long tendon, and this probably needs a little touch-up right here because the paint's coming off. This is the gastrocnemius. Now, here's the only way they can make this tricky. Look at the edge right here. You can see the gastrocnemius, and then you can see a muscle deep. You can see the gastrocnemius and a muscle deep right here. Right? That muscle that's deep is the soleus. So if we take this off right here, that's the soleus. And if you look at it, you can see the soleus. You see that it's on at least this side. You can see clearly that it's part of that.
So which one's the gastrocnemius again?
Gastrocnemius is the superficial one. So this part right here.
Oh, the whole area?
Oh yeah, it's big. It's the whole back of your. It's the whole sural area. This whole thing is the gastrocnemius. Then it sets on the soleus, as you can see here, or we could take that off and see the soleus. Everybody comfortable with that? Okay. Now, again, I'm going to look anterior surface. Anteriors are always going to be flexors. Okay. Now I go to the most lateral aspect, and this part that shows muscle fibers right here. It's called the tensor fasciolata. And the tensor fasciolata runs into this cartilaginous, or this connective tissue band right here. It's called the iliotibial band. Okay? Now, the iliotibial band is not on your list. They just kind of consider this whole thing tensor fasciolata. So what am I going to do? If this is on the test, I'm going to pick the marker up and put it right there. Because there really are two things here. Tensor fasciolata, iliotibial band. Cool? Now I work across. Once I found that, and I look for layers. The superficial layer, longest muscle in your body, the sartorius. Everybody okay with that?
Yeah. Fine.
Cool. All right. Second layer, vastus lateralis. It's a big muscle. It's lateral. End of story. Then we have the
Rectus femoris.
right in the very middle. Then you have the vastus medialis. And then you have this totally straight muscle right here, the gracilis. Okay. All of these are second layer muscles. They are all deep to the sartorius. Everybody good? Who made up a mnemonic for these? You need a mnemonic. So quiet, Nicole. Come on, you need to make a nice mnemonic for this. Okay? You know, something with T, and something with vastus lateralis. The very late, rowdy for rectus. I don't know about
Rowdy
vastus.
S female.
There you go. Well, okay. We need something for the vastus medialis. Make up a saying. funnier it is, the better you'll remember it. Okay, now, third layer. We go into the triangle. What's the triangle? Sartorius and the gracilis, right here. Cool? Muscle that runs almost parallel to the gracilis is the adductor longus. So find the gracilis. It makes the height of your triangle. Here's the hypotenuse. There's the base. This runs parallel to the height, adductor longus. Now, magnus is a little confusing. Magnus would mean broad or big. Here it is right here. And it would normally be right here, overlying the femoral nerve, the femoral artery, and the femoral vein. So normally it would be setting like my fingers are, right here. But it's been removed so you can see the vascular supply and the nervous supply. Cool? So this really runs underneath the longus and then covers these up. Cool? So here's your strategy, I hope. When you go in the triangle, it's got to be the adductor longus or the adductor magnus. Build the triangle. And even if they were to take this off, you can still see the remnants of the triangle right here. And they can't take their gracilis off. So you got a beautiful triangle.
So which one?
Longus, magnus. And magnus is really up here as well. Actually, it goes all the way underneath the longus. Cool? All right, let's go to the back side, the problem side that got me grumpy with a lot of people.
You need to buy some tender meat.
You need to buy some tender meat. Okay. It's always good to barbecue by tender meat. Okay. Tensor fasciolata. Biceps femoris. Semitendinosus sets on the semimembranosus. So, here's the tendinosus. Here's the membranosus on both sides. Tendinosus, they've been running all the stuff about Marcus Dupree. What did he do? He stretched his tendinosus